I'm going to be talking you through using the Axis Guide software. This is the software that you'll be using during the course of the training that you're on. And when you first open the software, you'll be presented with a blank screen such as we have in front of us now. Now there's some options up here, image and plan. We're going to be using just the planning option, not the image option. And for now we're going to be opening up our plans by clicking here. Do not bother with opening up the DICOM files, but open up the planning files. If we click onto the planning files, you'll be able to see a whole range of files that are ready for us to plan our implant placement. Now I'm just going to load up the plan now, and whilst the plan's loading up, I'm just going to explain the details of the case. This is going to be an upper maxillary case, replacing 4 upper anterior bridge here. If I look at this on the top right hand side, you can see the patient has a bridge which is using the canine and premolar teeth left and right to support this span of 4 pontics lateral to lateral. So this is our case, and I'm going to start by just switching out the models because this is actually an STL file of her model. So I'm going to switch this out by just going to this area here and selecting to switch it out. And this is the situation. We have some roots which are going to be removed in red, and we have in blue the segmented teeth which are going to be remaining. Now normally with CBCT scans, the 3D image has little diagnostic use other than perhaps to talk to patients and explain where you're planning to do things. It helps them to navigate. When we come to plan implant positioning, the 3D view can be very useful indeed. So for diagnostic purposes it's often not of any use, but when it comes to actually planning our cases it can be very useful. Now as you can see, there's 1, 2, 3, 4 sections to the screen. And these are the panoramic view, sometimes known as the pilot view, because this is the view that most dentists are very familiar with and comfortable with. And if I use my roller bar, I can roll on the mouse, and what I'm doing now is I am scrolling through those panoramic views, different slices in the panoramic view. And if you look at the screen on your upper left hand side, top left hand side, as I scroll I want you to look at what happens to that yellow line. So as I scroll out, the yellow line goes in, out, and that is changing the arc of our panoramic. So you can see here what the panoramic looks like. See the yellow line, which is the arc of our panoramic. As I use the roller ball on the mouse and I move the panoramic out slightly, you can see how this changes the view. So the first thing we need to do is just look in and out of this view, scroll the ball so that we get as much detail of the area in our pan view as possible. Now to help us do this, we can position the pointer over the image and press the space bar once. Now when we do that, we get a complete screen of the panoramic view or pilot view. Now this will help us to start positioning our implants. So we always start from the pilot view, and we want to add an implant here. So we're going to go to the left hand side and we're going to go to the implant section and we're going to select an implant, and the implant is going to go shall we say in the upper 1-4 region, which is going to be an immediate. We select this and then we look at our implant library, and in our implant library we have files or meshes of all the main implant systems, and we're going to be using the OsteoTie system, and I like to start on a 3.75 by 15, and I click on that, and here is a little three-dimensional picture of that implant. Now this has been generated from the engineering drawings, so it's an exact replica of the implant that we will be using to scale, and we can click on the validate button and we go back to that screen. Now when I move my cursor over the screen, you may just see, I'm going to position it by the crosses there, you may just see the little shape of an implant, and I'm going to position that implant in this area here, and I'm going to go one left click with my mouse and the implant appears. Now when I move my cursor over the implant, you'll see it will change from the pointer and it will change now to a little cross, and this allows me now to move and position that implant exactly where I want. So now I'm just going to position that implant mesiodistally where I feel it needs to be. If I was going to be keeping the canine tooth, then maybe I would move it and tilt the implant away from the root like so. Yeah? And by moving this over that axis there, you can see it changes to a circle with little arrows on it, which allows me to tilt and rock this implant like so. Now I'm going to leave this here. I'm going to go back to the arrow view. I've moved my cursor back into center and it's changed to a small arrow. I'm going to press the space bar on my keyboard, and now we can see again our four screens, and in particular we can see the screen just above, which is the transsectional view, and we are now going to look at that in some more detail. And again I'm going to position the pointer over the image I want, and I'm going to press the space bar on my keyboard. Now we can see that this in here, if we place the implant like this, it would be sure to perforate our labial plate. So we really need to move the implant maybe a little bit further in, and maybe we would want to tip that implant a little bit out of the way there, and maybe we could move it like this. So at the moment we're just playing around with positions. We can change this any way we want as we proceed. So now I'm going to come out of this full screen mode by again just pressing the space bar, and we can look at the panoramic view again by moving our mouse to the panoramic view and pressing the space bar. So now you can see the image of the implant isn't as clear. If I scroll through the different slices in this plane, you can see different slices of the implant because it's tilting away from us. I come out of here and I look at it here. And then what I can do, remember I said that the view sometimes in this three-dimensional view isn't that useful to us. I can now, by right-clicking the mouse, I can move that and I can see how that is positioning through the tooth. If I want to get quickly back to aligning that 3D image, I can reset it by clicking on the little circle here with my left mouse button. So here we are, that looks quite good. If I go to the actual view here, by moving the cursor to the actual view, I can click on that and I can enlarge it, and here I can see how the implant is positioned in terms of the interceptal bone and the teeth either side. Now if I was to scroll by using the roller ball, I can look at that position of that implant right the way down to where the apex is going to end up, and I can see that at the apex level it's still in bone, it hasn't perforated the nose. If I go up higher, of course, we can see how the nose eventually comes into shot, but we're way away from the nose. I can scroll back down, and as I scroll back down I can look at the relationship to the other roots. Obviously the 3 is going to be extracted as part of our treatment plan, but if that weren't the case and we were to keep the 3, Obviously we would want to know that there is at least 1.5 to 2 millimeters of bone clearance between the circumference of our implant and the circumference of the root. So this again is very useful to be able to scroll up and down, if you like, these actual views. You're moving up and down in the vertical plane and you're seeing exactly how the implant is lying between the roots. So I'm now going to come out of this view by going back to arrow and placing space. So yes, this is looking quite nice. We can now click onto here and we can say, oh well, this isn't looking too bad, but of course our crowns aren't clearly shown. We don't know where, if that is actually going to be where we want it in terms of our restoration. So let's now come to this part here and look at the imported image. Now what we did in this case was, before we started, we took impressions of the bridge in situ and we took impressions of the edentulous ridge with the bridge removed, because we were fortunate enough to be able to remove the bridge and take another impression of the roots and mucosa. And if we click on this little button here that looks like a speaker, we can actually click in the model with the teeth on. And we might be saying to ourselves, well, that is a little bit towards the distal, it might make restoration just that little bit more difficult. So what we can do is, again, we can move our cursor, changing it from an arrow to a little circle with arrows on, and we can just maybe move that a little bit and change the angle and see what that now looks like. So that's looking a lot nicer. It's coming through the labial, through the occlusion quite nicely. And again, we may well want to change the angle of that in the palato labial positioning. So we could just move it a little bit like that and see what that looks like now. Maybe we want to just change the mesiodistal angle a little bit and change that. Okay, so we've made those changes. The white cylinder or extension is placed on top of the implant to give us an idea of the abutment and where it's going to be coming out in terms of the restoration. Again, if I come out of that now, I can look at how the implant is lining up on our pilot view or our PA view, on our pan view, and you can see that if this was in fact going to be keeping the 3, we would be, by changing that angulation, we would be getting dangerously close to the apex of the 3. Again, if we were to keep the 3, we could go to our actual view and we could scroll down through that and see what it looked like in terms of where the apex and the implant, the root apex and the implant are. And although we're close, we're not dangerously close. We've still got our clearance there. The software would turn the implant red if we were too close. So we'd be happy to perhaps place the implant in that position, and also remembering that these is a tapered system, and a tapered system does allow us a bit more freedom when it comes to positioning implants between roots rather than using a cylinder. So we're happy with that. We're going to come out of here. Let's look at it in our transverse section. And again, we can see the implant is lining up nicely, and here we're now starting to see this line which represents the line of the plaster model we took, and we can see how that is very, very nicely now lining up in relation to our tooth, and it's giving us a lot more idea about where we're going from a restorative point. The other thing we can do is, if you look in this area here, it gives us the Handstram's units, and this will let us determine the density of the bone. So by moving this cursor up and down, if you look in that left area, you'll see that it's saying D1, D2. As we're moving around and up round here, it's looking like D5, it's coming down, we're into D3. Obviously it's going to go to quite D1 in this area because we've got a root. Again, we can look at how the bone density changes around here, so not as dense as you would perhaps think from the X-ray. So we're happy with that. So now of course we come to position our second implant. So let us position this second implant, and we're going to think about positioning it maybe in this area here, in the upper right 2 area. So I'm going to have to add another implant, and as before I'm going to select the region. I'm going to select my implant, which I prefer the 3.75 by 15. Obviously if I change my mind as we go along, I can alter that. So if I click onto here, then position my implant roughly where I want it, we're now ready to start sliding the implant to position. We don't want it touching the tooth, we want a 2mm bone zone, as I call it. So we're happy with that. If I did want to change the length of the implant, all I do is move the cursor back. I get the cross for repositioning the implant, and if I go to one of these red lines, you can see the cursor changes from the cross to an I for implant, and I can shrink that implant down to the next one in the sequence in the library, which is 3.75 at 12. So that implant is now 3.75 at 12. Similarly, if I wanted to change the diameter of the implant, I could grab one of these red buttons here and I could stretch the implant, and if we look now, it's a 4.5 implant by 12mm. So you don't have to go back to the library to make changes to your implant selection. So we're going to move it back to how we were before. And as I say, I'm happy from here. So we go from screen 1, which is the pan view or the pilot view, and we're going to go to the transsectional view. And again we have the implant perhaps coming out too far palatally in relation to where our crown needs to be and where our eventual bridge will be in this area. So we can again change our cursor to the round, and we can move that and get the angle about right. We can slide the implant and position it maybe coronally, and we're not too far off. That would be coming through the cingulum. Let's now come out of that screen. So we've looked at 1, the pan view, go back into 1 pan view, and now we can see the implant, because it's angled, does not show the full extent of the implant because we're actually slicing off through the implant, so we're getting different slices through the implant. Come out of view 1 and go to view 2, transsectional view. We're happy. We can go to the view here, the actual view, and we can pan up and down and see how the apex is in relation to the incisive nerve here, maybe a little bit close on the apex than we would like. Maybe we'll move that away a little bit, but we can see that it's surrounded pretty well by bone over its entire length. Here we're coming to just where the extender is. There's the hex of the implant, and here the extender starting. So maybe the cortical plate is getting a little bit thin there, but I don't think that's too much to worry about. And we are now able to go to screen 4, and we're going to look at that in larger, and we're going to right click on it, and we can see how that is lining up in there. And again, we may well want to change that a little bit and just change the view there. And you'll notice the axis of the implant is also shown above here, and I can just tilt that maybe from there, and that would be moving the apex just that little bit further away from our incisive nerve. I can look down from inside the skull, and I can see there is no sign of the implant perforating the nose. I can see there's no sign of any implants perforating the sinuses. So now I am quite happy with this arrangement. So we now have our implants positioned. I will look at I can switch in and out the models accordingly. So I can take the model out, I can see how the implants are lining up in relation to the teeth, and the eventual job that I'm going to do. As you can see, we now have the implants positioned, and we might feel that there's a little bit of dehiscence there, so we could in fact move the implant out slightly to try and reduce that amount of dehiscence on the plate or surface. But of course we would need to see how that might affect our other parameters such as dehiscence around here. So there's always a little bit of compromise when you're placing these. This might actually be more bone than actually shows, because the resolution of the bone is only very minor. If you want to actually see what it looks like really in the bone, we can go back to the transverse section here, and we can see that there is in fact quite a thickness of bone there. It's just the sort of burnout that happens on the 3D images. So let's reposition that, and we can look at that now. As I say, we really need to see that in relation to the final restoration. So again, we can switch in. We have two STL files. One STL file is of the edentulous ridge, one STL file is a scan of the bridge teeth. So I'm going to switch that in for you, and we've got now a better view of how that's coming out in relation to our final restoration. Now, it would also be useful to be able to see what those implants look like in terms of the edentulous ridge. So I can quite simply just right click that to remove the model of the situation of the teeth, and I can right click here, and now I get a nice model showing where the implant is coming out in terms of the ridge. Maybe that would be a little bit too, but then the other thing I'm looking at is this is where our gingival margin might end up, and in relation to the canine gingival margin and the gingival margin there, it's not too bad at all. So we might decide to accept that. Now, another thing one can do, I'll just line that back up again, we can change the colour of this by clicking onto there, and that's a left click onto there. We go to the STL file, and sometimes what I like to do is pick a nice red colour here, and that is going to be the colour of our gingiva. So we've now got a model of our gingiva, and then we can pop in there a model here. We can go back, we can switch out the gingiva, we can right click back onto the teeth, and now we have a model of our teeth, and we can click back into there. And because I haven't left clicked, if I right click onto here, the teeth come back in. Now, to get the teeth out, I would right click again and the teeth would go. If I don't right click out, the teeth remain, and then if I right click on here, obviously the gingiva comes in and out. So we can click in and out as we want. I can keep the gingiva, I can click out the model, so now I just have the image of the 3D image of the bone and the teeth, or I can right click and put the teeth in, I can leave the teeth in, and I can right click and put the gums in, or I can right click over the teeth and take the teeth out. So I have flexibility to be able to switch between the different views. Now, some of you may be thinking, well, why not position the second implant in the canine socket? Well, I personally prefer a more even distribution of the implants for support, but also if I click out the models now, you will see that when I take the models out and we zoom in on that screen, can you see how fine the bone is covering the buccal root of the canine? That's often the case. And if we go into the trans-sectional view, and I'm going to go back to the pilot view for that, I'm going to scroll, I'm going to see my canine, and I'm going to click just above the canine, and now the green line which shows us that's the slice, that's a trans-sectional slice. This is showing us the actual slice, which is quite high up, but I'm more interested in this green line because I want to see the trans-sectional view in this area. I come out, I go into the trans-sectional view, and look, we can see how there's barely any labial bone there at all. You can see how there's very little bone, which is often the case with canines, and so the chances are that when we extract that tooth we will lose labial bone. So that's going to be an issue. Then why not avoid that site altogether, because otherwise we're going to be into grafting and all other sorts of problems, and we're also going to get less bone surrounding our implant because the canine roots are quite long. So this is the situation quite clearly shown. So it's a very useful way to actually decide on the suitability of an implant for immediate placement. So looking at and trying to assess the suitability for immediate placement into a socket, another thing we can do is go back to this mode here, and the first thing we can do is we can go to our tools section here on the top right hand side. We can left click on there, and if we want we can actually remove or hide the extensions. We can also take out the background colour, and I'll change that to a nice white as such. So now we've got rid of the background colour, and then what I can do is we can't see the implants anymore because they have been removed. So here we go. Now we'll line that back up here, and I'm going to use this section here, which is a segmented objects. Now the mandible or the jaw, maxillary jaw, has been segmented yellow. The teeth that are to remain are being segmented as blue, and the teeth that we're going to be removing have been segmented as red. Now what we can do is by clicking onto either one of these we can remove different elements. So if I want to see the teeth gone and what it's going to look like with the teeth gone, I can click on the tooth here and I can remove the tooth by right clicking on it, and now we have the teeth that are going to be extracted, and we can start to maybe see what the implant looks like in the jaw. Now if I want to see the jaw in a little bit more change, I can sort of change the color of the jaw, but I'm now right clicking on the jaw, so I'm going to the jaw icon in this area here, and if I right click I can actually see now how the implants are positioned in relation to the teeth, which is quite useful if you're doing an immediate. But even more useful is that if I click back on the teeth by right clicking on the teeth, I can take out, if you want, the existing teeth by right clicking on them, and now all I have, I can right click on the mouse, and now I have the implants, and I can see, especially on the immediates, how much of the implant is going to be encased in bone and how much of the implant is going to be in a void, if you like, because where the red is obviously where the teeth roots are at the moment. When we extract, that red, if you like, will become a blood clot because there'll be no bone in that area, because this is where the roots are. We can see the nice little hook on the roots there, and you can examine the roots in relation to the implant. Again, if we wanted to look, if we were to be keeping that canine, we could certainly look at that in relation to other roots very nicely three-dimensionally, which is marvelous to be able to have that. We can of course move the thing around a little bit by just clicking on it, and we could change that and say, oh well, if we were to change it like that, obviously we'd get a lot more bone, but we need to just then confirm what that's going to do in the other views by coming out of it. So now I'm going to right click back onto the blue, which shows us our teeth that we're keeping. I can right click back onto the bone, and we can now see what that all looks like in relation to the bone. So this is our first two implants placed. Now I'm going to show you the final plan. All four implants have been positioned. If I click onto any one of the implants, I can see the diameter and the length quite clearly shown here. If I go back to the pilot view, we can see now that our 4 implants have been placed, 2 immediates in the premolar region and 2 delayed in our lateral incisor. Using the roller ball on the mouse, I can look at where these have been positioned. I can, by clicking on, I highlight the particular implant, the position where it is. So this one has been positioned here. Click here. This implant is this one here. So these were all different lengths. Obviously, by clicking either on the implant here, we get to see the length, or conversely, if we click on the implant here, it shows us where the implant is in our plan by this green line here. Remember, sorry, by the blue line. Remember that the green line is showing us the transverse section in this area. If I wanted to see the transverse section in this area, I would need to move the green line to this implant here, and I could do that by just clicking onto it. And now the transsectional slice and our implant are lining up. If I come out of that view and go back to the transsectional view, we can now see I've got a cut all the way through the implant palatolabally. Again, to go through that again, go back to our pilot view. If I wanted to look at this particular implant in the transverse section, I could just click in the region, the green transverse line would appear. If I click on the implant, it's now the blue line has appeared, which shows us the axis of the implant. And if I look in this box here, I can see the implant and I can see its dimensions and values there. If I come out of the magnified view by clicking the space bar and go into the transverse section, I can now see what that implant looks like in the transverse section. So this is helping me to navigate around. If I go to the actual view, which is on our image or our pane 3 here, we can see I have again the green, which is showing us the position of the transverse slice. I have the blue, which is showing us the angular inclination of our implant. If I click on the bone in that area, I can change the green, and now obviously I would be doing a transverse section through there. If I come out of this view by clicking the space bar and go to the transverse section, which is screen 2 here, again we can see that the slice and how that implant is looking in the transverse section. We can go back to this view and I can scroll using my roller ball. I can scroll up and down and I can see where the apex of the implant is in relation to any anatomy, especially nerves, because we don't want the apex to go into a nerve. We can also look at the relationship of our extender to the final restoration as mapped out through here. So that's good. We can scroll through and we can see that our extender is actually going quite nicely through the palatal surface of the crown. So I think we can be quite satisfied with ourselves that we really have planned this optimally. Some of you may still have concerns that this is maybe a little bit too far labial and this may not be labial enough. Some of this actually comes down to individual preference at the end of the day, but I would remind you, try to do this freehand and see how well you get on. You won't be able to argue over tenths of a degree or tenths of a millimetre by freehand. Even the most adept implantologists can only position within about 3 millimetres of the actual true position of where he wants to be, whereas this gives you positioning within 0.3 of a millimetre. So far more precise, far more guided, and a lot more security if implants are new to you and these are your first cases. And especially a big case such as this, you're now quite confident that the implants aren't impinging anywhere. They're not. If we zoom up on this screen here, we can actually see that there's no perforation of the nasal or the sinus cavities. we can see from a coronal point of view the implants will be restorable. They're in the right position mesiodistally within the crown. They're not coming out through embrasures. From a bone perspective, if I click out the model by just taking the model out now, and I click that model out as well, from a bone perspective I can see they're well housed in bone. So really everything to ensure the best possible success. If I want to come out of here and go into this section here, for example, or even better, I'll position my cursor to there and I'll go to the transverse section. As I said, you could even move the mouse around your implant, and by looking in this area here you can even get an idea of how good the bone is. Now you may wonder again what you can do, what benefit the bone is. Surely if it's D4 or D5 bone, that is what you have. Where this is very useful is it gives you an indication of how much drilling you need to do. Obviously if your bone is D1 or D2, you might decide to go up through the full sequence of drills. So depending on the system you're using and the type of implant design you've got, you could decide on which drill to finish at. So for example, if this was giving a reading of D4, D5, you might decide that you don't really want to go to the full sequence of drills. So if you had 5 steps or 5 drills, pilot, and then 3 or 4 sizing burrs, you may decide to drop down 1 sizing burr rather than over prepare the osteotomy and end up with poor primary fixation. With the system that we use, in a D4, D5 situation, really we would be advising just to use the pilot burr and 1 other sizing burr, and not to really go any further up the sequence of drills in order to maximize primary fixation. Now in the next video you will be seeing the template in action, and you'll be seeing the sequence of drilling in action as well, and you will notice that the surgeon will not be using the entire sequence for this very reason, because we've assessed the bone at being D3, D4, and if we look in the delayed areas, if I just click there and I've moved my green cursor to the delayed, I go to the transverse section, and again I can move the cursor around, and I can see with D3 here we're getting a bit better, D2, D3 there, I click to there, I click on there. So if you like, in this region here where those arrows are, if we look on the left hand side towards the top, we can see that it's D3. So this is telling us that maybe we shouldn't be going all the way up through the drilling sequence and just following the table blindly in a mechanical sort of fashion. We're actually going to prepare the bone according to its density. And again, as I say, you'll notice in our video that follows this that the site former is actually used at one point to confirm the angle of our implant, and also the implants are placed by using a slight tapping technique with a mallet to tap them in, again because the bone was considered not to be that dense. So by looking at the D value, it will also determine your placement protocols. At the end of this process, we're in a position to be able to send the file to a printer and have the template printed, which will be guiding our placement. In the next video you will actually get to see the template being used clinically to guide the drilling and osteotomy site preparation together with implant placement.